Well, good afternoon, everyone. We are at 12 noon, high noon today on Wednesday in July. And we're so excited to be presenting this webinar to you today. And we have visitors from not just the Dallas-Fort Worth area, but also from members of the Texas Business Group on Health, and hopefully many employers that are in other parts of the state of Texas whom we've invited to this program. This is the title is When Cancer Comes to Work, a Strategic Approach to Cost, Care, and Compassion. This is one of the several educational programs that we're offering to employers and their service providers in our Triple Crown Cancer Care series that is going out almost through this entire year, and is focusing on accessible, affordable, and exceptional cancer care. So today's program, with nearly half of new cancer diagnoses occurring in the working age adults, the employers are getting increasingly on the front lines of supporting employees, caregivers, and their teams that are navigating the complex health challenges. And the ripple effects ranging from productivity loss, workforce disruption, and long-term disability and turnover make cancer a critical business issue for self-funded plans, who most of you are with today. So we're just so pleased to have our speaker. This is Michelle Lewis. Michelle is the CEO of Care Communities North Texas and has a wonderful program to share with us today. She's been with the organization for 20 years, planning to retire at the end of this year. And so we're so pleased that she's able to present this program today. You'll see, there's several slides that she will be going over, and which will be managed by Sarah Rapps, who is also going to be kind of the helper and with the microphones and all the slide progression. So she also is working with the Cancer Center for in North Texas. So we're really excited about this program. I want to thank our sponsors, Genentech, Merck, Pfizer, and McKesson, who are our premium sponsors for this program. And so we're so pleased that they're participating in this as well. They're offering us lots of resources to use that are non-branded by these companies and very helpful as well. So we share those on our website and also in other ways than this. We have another program in our Cancer Care, Triple Crown Cancer Care series. That will be on August 19th. It's a webinar again. It's called After the Diagnosis, Navigating Cancer Care, Treatment Decisions, and Employee Support. And then the next program is really important. We hope that you'll all participate in this directly. This will be an in-person meeting. It's a Cancer Care Strategy Symposium in the afternoon of September 23rd at the DoubleTree near the Galleria. This is really, there are going to be several sessions within this program, and I hope that you'll attend that as well. We'll send you lots of information on it. And then the last but not least, big program coming up that will also be covering some cancer issues and many others that employers are facing is our 22nd annual forum. And if you've been to our previous forums with different themes, this one is Casino Royale, betting big on benefits. It's extended from a full day to a day and a half, and on December 2nd and 3rd, starting in the afternoon of December 2nd and on to all day on December 3rd. That's a Wednesday and Thursday at the Irving Convention Center. And you've seen us all show up in costumes before for our Yellowstone, for our Wicked last year, and other programs that we've had in previous years. And we'll do the same this year. And we'll have a casino night on December 2nd with the craps tables and blackjacks and other things as part of our during the reception. So hope that you'll plan on attending that. Employers are invited to this program complimentary, and the service providers who are our senior premium sponsors will also be there, and others as well. Lots of different showcases there. Let's see. You may connect with us. These are the QR codes in LinkedIn and YouTube. Hope that you'll take note of that. And then let me introduce our speaker today, Michelle Lewis. So I won't go into a lot of detail, but because her whole bio will be in the slide deck that we'll share with you. But as I said, she's been with the Cancer Support Community North Texas for 20 years. She is a licensed clinical social worker with a master's degree from UT Arlington and when she speaks today, you'll notice an interesting accent that you don't hear very often. She grew up in South Africa, but she's been in Texas since 1981, so she has not adopted the Texas accent yet. Neither have most of us who are newcomers to Texas at one time. I'm from Wisconsin, so you're hearing the Wisconsin accent as well. Michelle also is a breast cancer survivor. And this way she can better connect with the participants of her organization and what they're feeling and going through, and with you as employers on what you're going through as well with your employees and the family members who are diagnosed with cancer. This is the kind of a path forward. So, and again, thank you, Sarah, for managing things. Sarah Raps, with her talent as managing she's a clinical social worker and program director at the Program Support Community North Texas. So thank you for joining us today as well, and as our silent partner. So, and I will be a silent partner as well until the very end when we'll take questions from you. Please put your questions in the question box, and Sarah will manage that. Towards the end, Michelle will answer the questions that you have, or we'll send you information if you're asking for more information. And I think this will take about 45, 50 minutes and dealing with questions after that. And with that, thank you so much for joining us.
On my full screen, one moment, please. Here it is.
Good.
Great, we're good.
Okay. Hi, good afternoon, everybody. And yes, as Marianne Faison said very eloquently, first of all, Marianne, thank you so much for the introduction. You will hear an accent, and it is what it is. So hopefully everybody will be able to hear me and understand me perfectly clearly. If you have any issues hearing, please just drop that into the chat. And as Marianne said, I am going to go through our slide deck, and any questions that you have, let us know. We will do our very best to handle them either today or at some point in the future. So just a very bit of brief background about Cancer Support Community North Texas. We're a nonprofit organization that opened our first location in Dallas in 2002. And what we are, again, a nonprofit providing psychosocial and emotional support as what we perceive the essential complement to comprehensive cancer care. All of our services here are provided by licensed mental health professionals with expertise and training specifically related to cancer challenges that people face going forward. We are part of a global organization called the Cancer Support Community, which you will see includes Gilda's Club at the top right-hand corner of the presentation. We are Cancer Support Community North Texas, and we have our boots on the ground here located in Dallas. That all being said, we also have a wide reach in terms of, as you will see from the services we provide throughout the whole state of Texas and even beyond from time to time. So that being said, again, my sincere thanks to the Dallas-Fort Worth Business Group on Health, to Marianne, to Diana for helping to help us present this. It, I think, fits in perfectly to this wonderful series that they are offering, and we were delighted to have been included in this. So thank you again on that. So now it's telling me I'm getting an application update in the middle of everything. All right. You guys, I am sure, can see the screen. Are you showing like an application update in the middle of it?
We do. Apologies. No, I've got let me exit this for you.
Okay.
Doing my job as tech support.
Yeah, I tried to do that and it wouldn't let me do.
Tell you what, Marshall,
bear with us for 1 second. Wouldn't you know that some application would like to update in the minutes, in the middle of everything?
There we go.
Thank you, Sarah.
And do you want to just give me a little finger gun when you want me to switch to the next slide?
Okay, I will do that. Okay, so just a little bit about, as I've already mentioned, the largest professionally led nonprofit network of cancer support worldwide. And our focus is on uplifting and strengthening people impacted by cancer by providing support, fostering compassionate communities, and breaking down those unbelievable barriers to care. And CSC achieves that and our mission through 3 specific areas. So one of those is direct service delivery, which for us is the most important. We're here on the ground and we'll go ahead and intervene at any level, at any time, to assist somebody who's impacted by cancer. And then as part of our global network, we are supported by our Research and Training Institute and our Policy and Advocacy Institute. One of the things that I want to really point out as we move forward and we think about cancer, all the time we are focused not only on the individual with the diagnosis, but also on those who are there to support and provide care and supportive elements for them as they go through. And that is very important. So moving right along, this, I mentioned we're part of a global network. So when we speak with absolute authority. We know what we're talking about when it comes to cancer service delivery. You will see, if you scroll down, you will see there CSC North Texas. Hooray, that's who we are, and very proud to be that. We also have some healthcare partners. We are on location at some universities that are listed. And the thing that makes us global is that we do have affiliate partners in Canada, one in Baghdad, one in Japan, and one in Tel Aviv. So when we talk about who we are and what we do, we come with a slew of experience and all the best practice that is there to back it up. Okay, so we call this When Cancer Comes to Work. And what is that about? As we know, and we've all heard so frequently, the outcomes when you have a cancer diagnosis are absolutely impacted by early detection, by screening, early screenings, and adhering to that. And a big focus these days is on prevention and the ability to inform people about what can I do? What should I do? Is there something that we can do to mitigate the potential impact of a diagnosis or even getting an advanced diagnosis? One of the things we know is that by doing this proactively, we can reduce the healthcare spend. So in addition to being able to provide care and compassion for folks, we are also well aware that the cost of care to employers is essential. And by offering the services and this When Cancer Comes to Work service, it definitely helps to mitigate this expense on the cost of care. Increase productivity and operations. We're going to get into that in a little bit more detail here. And increase staff satisfaction and retention. We're going to get into that in a little bit more detail as well. But wouldn't it be great if we could have something out there that increases productivity and operations, reduces healthcare spend, and increases staff satisfaction and retention? And well, guess what? That's us, Cancer Support Community, North Texas. So a little bit about the landscape. Some stats just to, everybody's looking for data statistics to support their argument. Over 2 million new diagnoses of cancer were expected in the United States in 2025. Here in the North Texas area alone in 2026, we were anticipating 30,000 plus new cancer diagnoses. I want to just drop something in for your consideration here. As I mentioned, it's very important to think about the role that those supporting the individual with a diagnosis, how important that is. So if you just take that 30,000 number, and we know that approximately 4 to 5 additional people are going to be directly impacted by that diagnosis. If you take that 30,000, we already, just in North Texas, are talking about impact of 150,000 plus people through that cancer diagnosis prediction. Importantly, I think for everybody, 44% of the newly diagnosed are of working age. I'll say that again. So you know how that's going to factor in to the employment, the HR component of what you're doing. And this, of course, as a breast cancer survivor, is something I love to see, that the number of cancer survivors in the United States is expected to increase. We already are at 22 million plus to 26 million by 2040. And so with that, the reasons that that is happening, it's early detection, it's prevention, and it's improvements in treatment protocols. And so there have been significant and very dynamic changes in how some of the really tough cancers, like even pancreatic cancer and advanced breast cancer and colon cancer and kidney cancer, the improvements in treatment of those specific things are helping people live longer and helping people live well and helping people live a decent, productive life. Okay, so we're providing the psychosocial and emotional support for individuals with cancer and those impacted by them, which includes a number of different elements that we'll touch on more. But looking at it from a business aspect, 80% of working age survivors are returning to their jobs. Their jobs are important. They need to be earning. They need to be working. They need to feel productive. They need to feel hopeful. So 80% of folks who are surviving are returning to the workplace. 20% of cancer survivors, after 1 to 5 years, are still reporting some work limitations because of their diagnosis. So, I'll say this, once your doctor says, okay, I've seen you, you're great, I'll see you in 3 months' time, it does not mean that the challenges of having cancer have dissipated. In fact, we see levels of stress among survivors actually increase at the point that their doctor says, you're good to go, see you in 3 months' time. Sounds a little counterintuitive, but if you think about it, you'll understand that. Cancer is flat out the top driver of employer costs, and recent studies are showing, this number is mind-shattering, mind-blowing, $225 billion for medical care of cost to the United States employers. Now, that's just the medical costs. Studies also show that cancer cost employers another additional $139 billion because of diminished productivity and lost work time. So the numbers are huge and sometimes even a little difficult to wrap one's head around if, you're a small employer or if you're a mid-sized employer. But if you scale that, clearly the cost, just in terms of what it's costing for medical care and then the subsequent costs, which are really important, are significantly impactful at every level for your organization. So this program that we're able to offer when cancer comes to work, and we call it an employee benefit solution, brings a personalized suite of services for employees and their families and those supporting them in other ways, which includes their workplace, their extended community, or whatever. Remember, what I'm saying is a cancer diagnosis, that's one person, multiply that by 5, the impact of, and the ripple effect goes on. So as an employer, here's some of the considerations for the impact on the workplace. These are some of the things that come up. Obviously, the cost. We absolutely know that when cancer is in the workplace, productivity is going to decrease, not because people choose to be less productive, but just because pragmatically, when you've got to go for treatments and you've got to do scheduling, and also please keep in mind that many of your employees may be the folks who are supporting those people. We'll get to that, but they're also impacted. Absenteeism, absolutely. How does it impact your team and the way your team works together when you've got one person is out here and they've got to schedule appointments over here and they may not be feeling really well. So that kind of rolls into staffing challenges. What do we do with that? Do we make accommodations? Do we become flexible? Do we have to reorg on our staffing? When folks are finished their treatment or even during treatment and they've got to re-enter the workplace, what does that mean? What accommodations might need to be made for that individual? Can we do that? And then what kind of employee support can we, should we, must we be offering to individuals who are impacted by cancer? Really, I think significant questions, and I suspect many of you on this presentation have already been faced with kind of working through some of these items. Okay, we're moving on. What happens if you are the patient, you're the employee, you're in the workplace? The thing I'm going to tell you at the very top before I say one other thing is that cancer does not come with a workbook, does not come with a handbook. It does not come with a handbook for the person who gets the diagnosis, nor does it come with a handbook for anybody else who's going to be impacted by this cancer diagnosis. Number one, at the very top, you get a cancer diagnosis, horrifying day, your doctor says, well, I'm sorry, you have cancer. Your immediate thought is, well, am I going to die? Number one, nobody's prepared you ahead of time unless you're very fortunate to say there are a lot of myths around cancer that we'll talk about. You worry about your family. How's this going to impact my family? What is the treatment? I don't even know where to begin. The doctor said, well, we can do this, we can do that. I don't understand any of that. Are the medical bills going to pile up? Is my health insurance going to cover it? Do I have supplemental health? What am I going to need here? Do I need to consider, depending on, the stage of my diagnosis, do I need to consider end of life issues? Am I going to lose my job? Oh my gosh. Thank God I was in a position where I was able to work through my diagnosis and my treatment. But that fear of job loss is huge. What is going to be the impact on my broader community? And last but not least, which often is never even discussed when you first go in to visit with your doctor, what are going to be the side effects of this treatment? How long are those going to last? Am I going to be one and done? I get my treatment and then, hooray, I'm back to normal? The reality is no. And we are very poorly prepared to take that into account as individuals with a diagnosis, as those supporting those people. From a workplace perspective, we are ill prepared for that unless you've got the support in the background from an organization like Cancer Support Community North Texas. Looking at it from the perspective of the loved one. If you are the person who is working and your loved one has got the diagnosis, which again, remember, is going to be a significant number of your employee population. You're going to have to take time off to potentially drive your loved one or the patient to an appointment. You're going to have to be there when they visit with their doctor. You're going to have time to go through the test results and the scan results and all that. You're going to need to ramp up on resources. You're going to have to check on what are the insurance benefits, what are the financial consequences. You take on things that that person might have normally been doing, even if it was taking the kids to a soccer practice during the week after work or whatever it is. Or a lot of that shifts onto the role of the person supporting that individual. The need for relief and self-care for those folks is critical because burnout and compassion fatigue happens all the time. And by the way, don't think that the stress and tension of having to support an individual and all the care and concern that you carry for that individual don't precipitate distress, depression, and anxiety on your side. And they will, and they do. Okay, so these were some questions that were asked of caregivers. Okay, very important because remember again, in your employee workforce, there's going to be a big number of folks who are providing care for an individual on an ongoing basis. So, did they go in late, leave early, or take time off? 56% said yes. I don't need to read you the percentages, but they went from working full-time to part-time. They had to reduce their work hours or find out ways to flex their time. They took unexpected leaves of absence. Some of them even gave up working entirely, depending on the severity of the support that was required. Some of them received warnings about their performance and attendance at work. Did they turn down a promotion? A few of them said yes. Some of them decided to retire early, and some of them lost job benefits. That's a huge amount of impact on an individual who does not have the diagnosis. And how does that correlate and translate into what it looks like in the workplace? All right, here we go. If you're a co-worker, all right? And I'm going to say something now because I think that there's a thread that goes through everything related to what we're talking about, and that's communication and the importance of communication at multiple levels. But as a co-worker, and you find out, maybe somebody next to you gets a diagnosis, you don't know what should you say to that person? How do you look at them? What can you expect of them in terms of their contribution to the work team? Are they going to be absent? Are they going to impact your team's cohesion? Sometimes, because of the circumstances, people might feel guilty for assuming opportunities which may have gone to a colleague who had a cancer diagnosis who was unable to do that. And then, with all the good stuff and the hopefulness that I'm putting out there and must put out and project, we still do lose people to this disease. And then how do we handle that? How do we handle bereavement in the workplace? How do we support a colleague who loses somebody to cancer? So, as you can see, the thread here through all this conversation is that it's not, oh my gosh, so-and-so has a cancer diagnosis and everything is going to be back to normal. It does not work that way. It's a very complex situation. All right, so what are some of the components that Cancer Support Community North Texas can come in to supplement or to mitigate or to help folks when they have got this particular situation coming forward for them at whatever level. And we'll dive into that. Again, we're focusing that this is an employee benefit solution. One of the things I call it an unintended positive consequence of COVID was that where we previously, and we still do, provide our services in person. So somebody can give us a call, they can walk into our physical location, and we can meet with them in person. But we were forced to look at how do we deliver our services in a virtual framework, because we've got to reach people. When people are ill, COVID aside, and they're isolating, they're afraid, they don't know what to do, you want to be able to give them something to hang their hats on. So part of our virtual programming includes informational sessions that are interactive, kind of like we're doing today. You know, whether they're led by mental health professionals, by physicians, nutritionists, any other professionals who focused on updates and trends in cancer treatment, and guidance on things like how do I eat healthily? How do I support my loved one with cancer? And other topics of interest to employees. And some of the aspect of this, again, can be prevention upfront and can be very proactive in terms of how do we extend and expand communication around this, which can also be done virtually. We have a super robust survivorship program. Okay? Who's a survivor? So some of the definitions of this are changing to it used to be you were a survivor from the day of diagnosis. They've changed that. So it's from the day you complete your first line of treatment now. But the challenge is, what happens when you're done with your treatment? The answer is, we have a program called Cancer Transitions that just lets you know that, okay, here's what you're going to want to look at. Here's some things you can do to get back to a healthy eating pattern, an exercise pattern, relationships. These are some of how do you get back into your work? Are there things that have got to be adjusted for you because of some of the limitations and challenges you're facing? So we have this very long-running and widely utilized survivorship curriculum called Cancer Transitions that we can deliver in a workplace if that is something that is of interest. I love this one. Empathy training for managers. So, you know, I think about the fact, so here I am, the CEO of an organization who has her own cancer experience. And I can tell you that if a staff member comes to me who's been diagnosed, even though I know what it's like for me, as a supervisor, as a manager, I could always do with some help in being more empathetic or in meeting that person where they are and really being a good listener. So we can offer training as well for supervisors, managers, really at any level that will raise awareness. And guys, here's what it is. A lot of this, again, remember I said communication. So much of this is about communication and how you set an atmosphere in your organization that reduces the myth and the stigma of having a chronic illness in your workplace. And say, yeah, we get it. That's life. Life happens. You know, we don't plan. We plan for retirement, for our kids going to college, for us going to college, for our vacations. Do we plan for cancer? I know I didn't. So again, you know, I think arming supervisors and managers with information that's proven that we know works across a continuum of here's what you can say. We know that there are HIPAA considerations. We know all about those things, but there's still so much you can communicate and offer that's going to be of benefit to folks. And wouldn't it be nice if you were an employee who was struggling either with a diagnosis or supporting a family member or a loved one to go to a supervisor who could listen and say, and had some background and training in, okay, this is what that person may be going through, and they are better armed to respond that. Guess what you're going to be doing for that employee? We're going to dive into that just a little bit more, but there is a cancer support hotline that we offer as part of being in a global network where folks cannot get to us because, we here locally in Dallas, but they live in San Antonio or Austin or Houston. Believe it or not, Cancer Support Community North Texas currently is the only organization in the whole state of Texas, and I'm saying currently very purposefully, who is offering this kind of comprehensive program of cancer support. Remarkable to me because of the need. But nonetheless, there is a cancer support helpline that is available for folks where they can go to with infinite resources available through that. These are some of the resources that are currently available to anyone who has an interest. Educational resources. Education is power. If I can tell someone how could speak to and communicate with their kids, is that a benefit? If I'm telling somebody who has a specific kind of cancer diagnosis, here's some information for you. If I could tell somebody, hey, do you need some additional resources? Here are some additional resources, and those are all available or can be provided. And we do, as part of what Cancer Support Community North Texas does, have a full-time bilingual resource specialist. And it's locally focused. So if you've got somebody who's in this area, we do not provide financial resources per se. But if you've got somebody who doesn't know how they're going to pay for their prescription drugs, because all of a sudden they're taking a medication that's just blown them out the water, you can call us and we can help you figure that out. Some people need help paying for their rent or their mortgage because of the huge financial impact that cancer brings into your life. We can provide that directly, but we can perhaps resource that for you. So that resource and that it's provided bilingually we have a Spanish speaker that is able to help folks with that is huge. And yes, I will say to you, these services are provided, let me put it in there, at no cost to the participant. So certainly at no cost, it is at a cost to Cancer Support Community because we've got to employ staff. But if you're on the receiving end of a diagnosis or you've got a loved one who is, they can come to us and everything, including, my gosh, think about this, groups, individual counseling, healthy lifestyle exercise programs, and all that kind of stuff at no cost. What a huge, beautiful gift is that to be able to offer out there. So the educational resources also, people want to know about clinical trials, really specific other information, and that is available. Again, we'll try and circle back to some of the questions a little later and provide you some answers to the questions that, thank you so much, I see popping up here. Okay, so there's your personalized digital community that's available called My Lifeline. So that's the kind of thing like, if you don't want to answer 75 phone calls from concerned family members, friends, you can set something up that gives updates on your progress that if you need a ride or you've got to get to appointment, you need help getting the kids to soccer, or you need somebody to go pick up your laundry or do some shopping for you, you can kind of set up a schedule and share that with your family members, etc., and they can help you that way. Discussion boards. So while we provide localized support right here, if you can't get in and want to go, you live, I don't know, Houston, you could, there's still resources we can provide to folks who live in Houston because we have a really robust digital program. But you can go online and connect with other people who are impacted by cancer. Again, just remember, all of this is moderated by licensed mental health professionals. And it covers such a wide range of topics: treatment, nutrition, support for caregivers, all of that stuff. No, what we aim to do is to take the scary out of cancer, wherever you are, at whatever level, and we can do that and do that very effectively. These are just some additional, more personalized navigation. People might want to know, how do I get hold of a second opinion? I have a specific diagnosis. Are there clinical trials available for me? That information is available through our global connectivity. We can help, I love this one, assistance preparing for doctor's appointments. What do you do when you don't know what questions to ask? We don't provide medical referrals. What we will do is help you figure out what information is it important for you to gather from your healthcare provider at your next visit. Maybe your daughter's getting married and you want to know if you can delay the onset of chemotherapy till after that. Maybe it's really important for you to go on a trip. Those are things that are very important for quality of life issues, and being able to kind of pull that together ahead of time, because again, your doctor has got 15, maybe 20 minutes of, you've got their undivided attention. They are focused on you from a medical standpoint. They're not focused on, they're good, they're great. Thank God we're blessed with wonderful resources from a medical standpoint. But they're not focusing on, how am I going to manage getting my kids to prom? That might be a really important question to be able to ask somebody. Support in assessing options and making potential treatment decisions is something that can be talked through and guided without making a definitive declaration. Nutritional guidance. You might want to know, hey, I have this particular kind of cancer, because, by the way, cancer is not one size fits all. If I use breast cancer as an example, within a breast cancer diagnosis, there must be, I don't know, 250 different nuances of different things going on. Okay, I want to move right along because this is really important and I want to be able to spend some time. Okay, so if you invest in providing some, from an employee, some compassionate, supportive elements for your employees, is there going to be a return for you as an employer on that investment? Okay. Here's some other things. You're going to reduce your healthcare spend because 34% of cancer patients are at risk for clinical depression. That's a high number. They are at risk for anxiety. For every dollar that is invested in providing mental health support, there's going to be a return on investment of $4 in terms of improved health and productivity. That's a pretty good return on investment, I would say. Reducing the healthcare spend, okay, by encouraging screening, being proactive about prevention, bringing in education. You are going to be, if you as an employer are providing that information, fantastic. You are going to really be providing something of huge benefit for you. Reduce healthcare spend again. You've got a healthier workforce because of some of the stuff you're doing proactively. no-brainer. You can lower your healthcare premiums because you're not going to be accessing those benefits as much. Increasing productivity and operations. Okay, so this goes to the billions of dollars. This is the cost to employers that we referred to earlier. Days of lost productivity, sick day, short-term disability, and these are in billions of dollars. Impaired performance. This is that other side of the cost other than what it costs medically, the cost to US employers. I love this. Increasing satisfaction and retention. We know that every time you've got to replace, hire, onboard, train somebody, it's an expensive proposition. If you can reduce turnover and keep valued employees, that's a huge benefit to an employer. And it all goes to the annual cost of turnover, which are those of you in HR or are crunching your numbers and expenses on benefits and insurance, absolutely no. So by providing some of these elements of support proactively and upfront, this is where it's impacting. We just kind of touched on how nice it would be. These are some of the questions that people are asking and saying they have their big concerns about. They need more information and some additional guidance. What's available out there? This again is somewhere we can come in to amplify some of the things that are already being done. But look at that, the total cost of employee turnover, and we know that to recruit, train, onboard, et cetera, 1.5 times again of their annual salary. Huge. And if you are doing some of this stuff for your employees, what are they saying about you? What a great place this is to work. They care about me. This is amazing. You want to come and work here. I want to stay here. I want to be productive and appreciative for everything I'm getting. These are some folks who've already written about the impact of cancer and the cancer stigma in the workplace. These are folks we've all heard about: Forbes, CNN, Fortune 500, The Times. Providing social and emotional support improves their mental and physical health. And I cannot emphasize this enough. It's an integral part of cancer care. It's not a nice thing to do. It's a must-do thing to do. Testimonials. We're going to circulate these slides so you can read. You don't have to believe me when I tell you how fabulous it is to be able to incorporate some of this stuff into the structure of your organization. You can see what other people have got to say. I'm not just saying this because I think it's so. I'm saying this because we're providing you with the reference material on which this is actually factually based. Is there anything else? I thought our contact information is below. What I want you guys to realize is that Cancer Support Community North Texas is available here and now to anyone, wherever they are and wherever you are as an employer in Texas. Now, we maybe couldn't deliver some of the real in-person services if you are in Houston. We could. We can, yeah, just ask me, can you do it? And I will most likely say, yes, we can. We will figure it out. It's that important to us. It's that important to the people that we choose to serve and to assist as they are going through this huge challenge of when cancer comes into the workplace. Cancer Support Community, I think, is a huge benefit from an employer and employee standpoint. So please, there's Sarah's contact information, Chad Black's contact information. You'll receive additional information and another. I know Diana's going to send out a worksheet So let me stop there because I also want to see what questions that we can answer as quickly as we can. If we can't get to everyone, I promise you we will get your questions answered. Okay, Sarah, can you shoot some at me?
Yes. Are these services free and can anyone use them?
Yes and yes. That's really the simple. Now, that all being said, anyone who's impacted and needs the supportive services, it's absolutely free to them. Some of the things that we've mentioned, like cancer transitions, if we've got to deliver that on site or do some on-site trainings or something like that, there would be a minimal cost involved. And that's very flexible and can be adjusted depending on the needs of a particular employer.
How can someone access educational materials?
Well, you can go, we've got some of those things are available, recordings on our website at cancersupporttexas.org, or you can go to cancersupportcommunity.org, and that will kind of guide you also through, that's the global website, through a whole plethora of options and opportunities.
And I am posting that in the chat box, a link to our national website for that.
Thank you.
Great. And the next question is, will we get a copy of the slides?
Well, since you guys asked so very nicely, the answer to that is very definitely we'd be delighted to provide that to you.
Another question has to do with projections of future cancers. They specifically cite slide number 6. We will be sharing our presentation slides, which do include the references for all the information, including where the statistics come for the over 2 million cancer diagnoses in 2025 and the 26 million by 2040. We've also got some thank you messages and an LOL thanks in the chat box. And if no one has typed, if there's more questions that have not been typed in, I'm not sure if there are capabilities for someone to simply unmute and ask it themselves, but we do still have time for a few more questions.
Sarah, I think anyone who is interested in raising the hand and asking a question, you can you just simply click raise hand and we can facilitate for that for you.
Great.
Well,
I think as we wait, Marianne, just for a few more minutes, let me just reiterate, this is a lot of information and as you look at that, you could think, oh my gosh, this is just so much and blah, blah, blah. We can boil it down and keep it as simple in a conversation as finding out what is it that you really would like to do? What would you like to explore with us that we're able to offer, and we can have a more in-depth conversation? Sarah, there was something come in quickly.
That was me sending our local website. As Michelle mentioned, we are part of an international group of affiliates. I have posted our website, which is cancersupporttexas.org. And the earlier link I shared was looking at some of our national educational materials.
Thank you.
So what you're saying is it's available all over the country at other.
Correct.
Other
Yeah, it's a very wide-ranging affiliate network. So you're getting the full-blown best practice in terms of what has been developed that we know is helpful to people. You know, we know that folks are safer. The two things that come up when I have conversations with folks, they say to me, you know, I'm really worried about, I'm employed, okay, whether they're the person with the diagnosis or a caregiver, I'm employed, I'm worried about the impact of, am I going to lose my job? Number one. And the other one is, how do I communicate better with my supervisor, with my healthcare provider? So that's where that whole communication piece comes in. Thank you, guys.
And we will be including these links with Diana when she's sending out any follow-up information. So we'll make sure everything we've discussed, both our local affiliate and our our headquarters, we'll make sure that's all shared with participants. And we've gotten another thank you message saying that was great. Thank you for hosting the session, Michelle.
No, our pleasure. Thank you, Marianne and Diana.
Well, let me just add, basically in closing, is so much gratitude to you for sharing this information. We've done a lot of programs in our Triple Crown Cancer Care Series, that focuses on a lot of the benefit strategies that employers are using, or we hope they would use, on the pharmacy benefit, the high cost claims that they're managing, the specialty pharmacy, CAR T therapies, provider navigation to find the right providers, and a lot of the benefit strategies actually that our benefits managers of all the large and mid-size and large employers are doing, our members. And this one that you're offering us today, have offered, is so outstanding because it actually gets to the human side of it, the patient side, and the actual thinking and the managing the challenges that the patient, him or herself, is dealing with. So to me, that's the highest value that you're sharing today, and really, really appreciate it. The resources you're offering free to the employers is amazing. The discussion boards, I thought of that. I thought, wow, if a patient has an employee has cancer, wouldn't it be cool to offer that kind of a resource to talk to others who have similar types of cancer experiences? The personalized navigation tools that you're offering, those, I took some notes here. I know they're in the slides already, but some really stood out as being really important. The My Lifeline, oh my God, that is really a wonderful resource. I was thinking about when a patient has cancer, an employee has cancer, everybody wants to know what's happening, or any serious problem. And it's so challenging to have to sit down and key it all in and keep them up to date. And this is wonderful news. And of course, the educational resources that you've offered, one-pagers, multiple pagers. So that wonderful resources. Thank you so very much for sharing all of this. Any other questions from anybody? If not, then let me just remind everyone about the next webinar, where we'll be talking about navigating cancer care. You addressed that in today's discussion to a degree, and this will be a whole lot more, probably expanding what you've talked about, from the benefits management standpoint on treatment decisions, navigating cancer care treatment decisions, and employee support, and probably repeating a lot of what you shared today. So that is on Wednesday, August 19th at noon, a similar webinar. And then again, the Cancer Care Symposium that we're offering, the Strategy Symposium for Benefits Managers, that is on Wednesday, September 23rd. It's an afternoon program. It'll be in person, Doubletree, Dallas, near the Galleria. It's up off of LBJ, near the Galleria. And that alone, as a half day afternoon, has multiple speakers and sessions that will focus on different aspects, some of which of what you've discussed today. So it'll be a lot of benefit strategies and communication strategies and so forth. So encourage all of you who are participating in today's webinar to please mark that out in your calendar. It's a very important session. If you're a member of the Dallas-Fort Worth Business Group on Health as an employer, you may attend complimentary to this program. Always, our employer members attend all of our programs complimentary, and wonderful interactions with fellow benefits managers from other companies and with the experts who will be speaking to the different sessions. So with that, I want to thank you again for your time and your thoughtfulness and the wonderful resources you've offered. We so much appreciate it.
Well, thank you for the opportunity. Like I say, my parting words to you is tell somebody about Cancer Support Community North Texas or about Cancer Support Community. It's a gift of hope for somebody when there's incredible challenge at a very difficult time. So
we will add that to our website as well under all of the cancer care programs. So
thank you so much. We appreciate it. Thanks, everybody.
Michelle, good luck in your retirement. I hope we see you before that.
Yes, ma'am. Let's do it.
And Sarah,
okay. Take care.
Bye now.